You know, a lot of times I hear people talk about how important it is to build good habits, but the reality is sometimes you need strength to do something difficult. And there's no habit in the world that's going to make you not want a cigarette when you see it, or want a donut when you see it, or make you want to avoid something because you're anxious. There's a real impulse and a real feeling that you need to deal with. And this power of acceptance seems to be the best strategy for dealing with these difficult emotions, these difficult thoughts, and these difficult cravings. And any attempt to kind of push them away or get rid of them backfires. But being able to ride them out and imagine them as passing experiences that you don't need to act on has been shown to help a lot of different willpower challenges, including the kind of anxiety that leads us to not do things we know we should do. Intrusive thoughts, you know, that's a real willpower challenge. Sometimes our mind goes places we don't want it to go, to memories or to things we're imagining or to negative thoughts about ourselves and others. And research shows you can apply the same technique to a negative thought without having to act on it. It's been shown to improve weight loss. This technique of learning how to accept your own cravings tripled the long-term 1-year weight loss success rate among people who were in a really standard weight loss program. It helps substance abuse, and it even helps people with schizophrenia. I mean, talk about a willpower challenge. When you have voices in your own head that you cannot escape, and you're trying desperately to have some kind of normal life and relationship with the world when you've got these voices in your head that are telling you to do something or not to do something. And studies show that schizophrenics who learn to accept their own intrusive thoughts and hallucinations and delusions, like a craving that's not real and you don't need to act on it, but it's gonna be there and eventually it will pass, they actually end up being more likely to be out of the hospital, to be dehospitalized and function normally compared to people who have not been taught this technique.